Okay, in this video we're going to talk about body cavities and membranes. Now, the body contains lots of internal cavities that are closed to your external environment, and these cavities provide different degrees of protection to the internal organs within them. Now, we have two major body cavities, the dorsal and the ventral body cavity. Remember, dorsal meant backside or posterior, ventral meant belly side or anterior. So the dorsal body cavity is going to be more posterior than the ventral. Now, the dorsal body cavity has two major subcavities within it. It's made of a cranial cavity, which includes your cranial bones that encase your brain, and the vertebral cavity, which is the space along your vertebrae that encases your spinal cord. So the cranial and vertebral cavities together make the dorsal body cavity. And it essentially protects your fragile nervous system because your nervous tissue, like your brain and spinal cord, is very soft and delicate. Now, you can see that here. In gold is the cranial cavity, and this right here is the vertebral cavity, and together they make the dorsal body cavity. Now, the ventral body cavity contains your thoracic and abdominal pelvic cavities. And the thoracic cavity has lots of subcavities within it, but really what separates the thoracic from the abdominal pelvic cavity is this structure here called the respiratory diaphragm. It's one of your ventilatory muscles to breathe, but this is a large sheet of muscle that separates the thoracic and abdominal pelvic cavities. So ventrally, we have the thoracic and abdominal pelvic cavities. And this houses many of your internal organs, which are collectively called your viscera. So viscera means guts, which kind of makes sense here. And there's two major subdivisions. Remember, ventral body cavity can be subdivided into thoracic and abdominal pelvic cavities. Now, the thoracic cavity has subcavities within it. So it actually has two pleural cavities, each containing a lung, because you have two lungs. And then central to that, we have a mediastinum. And the mediastinal cavity contains a pericardial cavity, which surrounds your heart. And then the mediastinum also surrounds other thoracic organs like your esophagus, your trachea, the thymus. All of these are located within the mediastinal cavity. There's only one of these, and central in the thoracic cavity. The pericardial cavity is a subcavity of the mediastinum, and this is one that encloses or encases your heart. And remember, the thoracic cavity is separated from the abdominal pelvic cavity by the respiratory diaphragm. It's that sheet of muscle that separates the two cavities. Your abdominal cavity contains digestive organs like your stomach, your intestines, your spleen, your liver, even your kidneys and pancreas. Those are all located within the abdominal cavity. Now, the pelvic cavity contains your urinary bladder, internal reproductive organs, and the rectum. And these two are separated by some serous membrane, which I'll explain here in a little bit. So just to summarize this, remember all of this in red is the ventral body cavity, which can be subdivided into thoracic and abdominal pelvic cavities. Remember, the thoracic cavity is separated from the abdominal pelvic cavity by the respiratory diaphragm. And then within the thoracic cavity, we actually have some subcavities, right? We have two pleural cavities on the side, each one containing a lung. We have the superior mediastinum, which contains your thymus, your esophagus, and your trachea. And then we have the pericardial cavity, which is still part of the mediastinum, that actually encases the heart. Now, in the abdominal cavity, we have our liver in here, our stomach, our spleen, our kidneys off the side, our pancreas, our small intestine, and large intestine. And collectively, this contains the viscera, or guts. And then your pelvic cavity contains your urinary bladder, which stores urine, the internal reproductive organs like the uterus and other accessory glands, as well as your rectum, which is the end of your large intestine. That's the pelvic cavity. Now, the pelvic cavity is actually sort of encased within the pelvic bones here. You can see that. But it's also anatomically distinct from the abdominal cavity because many of these abdominal organs are surrounded by a serous membrane, which is not in the pelvic cavity. So that's sort of the dividing line is the fact that this is the serous membrane that stops and doesn't surround pelvic organs. Now, membranes in the ventral body cavity have a serosa, which are also called serous membrane. And I've mentioned this is a structure that surrounds different organs. And in terms of the structure of serous membrane, it's a very thin, double-layered membrane that covers surfaces in your ventral body cavity. And it's actually double layered. So you have two major layers, parietal and visceral. Remember, viscera means guts. So the visceral layer of this serous membrane is what directly surrounds the internal organ, or viscera, hence the name visceral serosa. The parietal layer, which is on the outside of the organ, doesn't directly surround the organ, but it does line internal body cavity walls, and these two layers are actually separated by a slit-like cavity filled with fluid called serous fluid. Now, serous fluid is actually made by these layers here. So parietal serosa and visceral serosa make serous fluid, which is a lubrication type of fluid. So it means these two layers here are lubricated between each other. And this fluid actually is secreted by both layers, and it separates those layers. So where you find serosa? Well, you find some serosa around the heart. In fact, the serous membrane around your heart we call pericardium. This also defines the pericardial cavity. The serous membrane around your lungs we call the pleura, and this actually defines the pleural cavities. And then for a lot of your abdominal organs, those are surrounded by a serous membrane called peritoneum. And peritoneum is a serous membrane that surrounds many of your abdominal organs. So it turns out that serous membrane, it's a double layer membrane, and it's structured a lot like a fist in a water balloon. So if you look at my cursor here, you find that the fist, let's say, is like the heart, where your heart's approximately the size of a fist. And you can imagine if you can stick your fist into this water balloon, there will be a layer of balloon that's right on your fist. Now, if this were your heart, we'd call this the visceral layer of pericardium or serous membrane because it's right on your organ or heart. Now, around that, on the outside, over here, this would call the parietal layer because it's not directly attached to the organ, but it would be attached to other internal body surfaces. And then these two layers here, the visceral layer of pericardium and the parietal layer of pericardium, will be separated by a thin, fluid-filled layer here called the serous cavity, which is filled with serous fluid. And what this allows for is, if you move your fist around inside of this, these two layers wouldn't rub up against each other. In fact, they would be lubricated, and it helps to reduce friction around your heart, considering your heart moves a lot, right? Even at rest, it's going to pump blood or move at least 60 times per minute. So you can see here that this is the pericardium. This is serous membrane. Remember, it's a double layer of membrane here. The layer that's right around the heart is called the visceral pericardium. And the layer that's not on the heart but surrounds the heart is the parietal layer of pericardium. They're separated by a thin fluid-filled space called the pericardial space. In this case, it's a serous fluid-filled space. And that serous fluid is a lubrication type of fluid that reduces friction, around the heart because the heart's going to move. And basically, that's the function of serous membrane, is to reduce friction around organs that move a lot. So, in terms of other ways we can look at our body cavities, in the abdominal pelvic region, we have quadrants and regions. Now, the quadrants are divisions that we use in a sort of a medical setting, and the divisions are regions that we use. They kind of look like tic-tac-toe, and they're mostly used by anatomists. So what this slide is showing is the abdominal pelvic quadrants. We have four major quadrants here. We have the right upper quadrant, left upper quadrant, left lower, and right lower quadrants. And these are basically sagittal and transverse lines that would intersect right at the umbilicus or belly button. So for the structures that are upper and towards the right, we call it the right upper quadrant. You can see it contains these particular organs like your liver and gallbladder, some of your stomach and duodenum, a portion of your large intestine and small intestine, as well as a portion of the kidney, which isn't visible here, but it would be posterior here. And then the left upper quadrant contains most of your stomach, a little bit of liver, some of the large intestine and small intestine, as well as your spleen. And that's sort of unique to the left upper quadrant. Now, the left upper quadrant also contains the majority of your pancreas, which is just posterior to the stomach here. Left lower quadrant contains a lot of small intestine and the distal part of the large intestine. And then the right lower quadrant contains also a lot of small intestine, as well as the proximal part of your large intestine, as well as the vermiform appendix, which is here. That's your appendix. It's a little extension of the cecum, which is the beginning of your large intestine. So what I want you all to know then are basically the organs that are contained within each of these quadrants. It's clinically relevant because if someone complains of pain in their left upper quadrant, it could relate to any of these organs, possibly the spleen, the stomach, the liver, a portion of the large or small intestines, or the pancreas. So this is showing the abdominal pelvic regions, and it has a kind of a tic-tac-toe sort of appearance. And this is essentially divided into the hypochondriac regions, right and left. This term it means hypo means below, chondro means cartilage. So hypochondriac means below the cartilage, because in this part of your chest you find some costal cartilage or rib cartilage right here. So the right hypochondriac region is just below the costal cartilage, hence the name hypochondriac. And the left hypochondriac is on the left. Now, epigastric is right in the middle here, and epi means nearby or surrounding. Gastric means stomach, so it makes sense. It would contain a decent portion of the stomach, hence the name epigastric region. Just inferior to the epigastric region, you got the umbilical region, which is nearby your belly button, or umbilicus. That's just medial to the lumbar, so the right and left lumbar regions are just lateral to the umbilical regions, and those would contain, the large intestines, so the ascending colon and the descending colon. The hypogastric region is also called the pubic region. This is going to be located just above the groin, and this would contain portions of your small intestine as well as your urinary bladder and other internal reproductive organs. And just lateral to hypogastric, we find the iliac regions. They're named iliac because the pelvic bones that are nearby, we have the ilium. So the iliac region refers to the bone that's nearby. It's also called the inguinal region as well. Now, the right iliac region would contain your cecum as well as a portion of your vermiform appendix, and the left iliac region would contain portions of your sigmoid colon. So it's important to know what organs are contained within each of these regions, as well as the names of these regions, because it helps us form a good framework in anatomy, as well as make predictions about what organs may be damaged or experiencing trauma if there's pain that's emanating from any of these regions. So it's also important to know what organs are contained within each of these regions.